Hi there, it's Sarah here from BJC Health, coming to you from Sydney, Australia. Thanks for showing an interest in one of our educational events. You're about to watch part one, so enjoy the event. If you've got any questions about the content, then please consider joining BJC Connect, where you can access all of our facilitators live. Otherwise, please consider leaving a comment and we'll do our best to get back to you.
Again, welcome. It's really nice that all of you decided to join us again on a Wednesday night this fortnight. I know for those of you who are Sydney-siders, it's been a very unusual week, so it's great to see you all online. As always, we'd like to, often we'd like to start with a poll. It gives us an idea of the people who've joined us here tonight, why they've actually attended. And so if I can, I'm about to share this poll. If you get the chance, quickly put your answers in. Let me launch the poll now. And really just want to know how many of you actually have heel pain or Achilles pain, and why you decided to attend tonight's webinar. So whilst I'm waiting there, if all of you can try to answer that. Belle, can you see the actual poll? No, you can't. Let me go back. Let's see whether I can relaunch it. Is that better? Can you see the poll now? Excellent. Thank you. So instead of answering in the chat, you can now answer. Oh, brilliant. Thank you. Many of your responses are coming through now. And Belle, I'm not sure whether you can see the results. Oh, you can. Very good. And then when I end the poll, there's still a few of you to answer. I'll give it another few seconds. At this stage, it's heel pain by 56%. Very closely followed by Achilles pain, and about a third of you also have another foot condition of some sort. A couple more seconds, and I think I'll end the poll there. And I'll share the results with all of you. Hopefully you can see that. So most of you have heel pain related to the plantar fascia. And Achilles pain. So it's, I think, to some extent, a pertinent topic, and really, it's from our survey results when Sarah and many of us have spoken to you, you've actually requested this particular topic. Dee, thank you. It's great that you're just interested in the talk. So I'm going to stop sharing there now, and we'll start. And so What's complex about many areas of the body, the foot's no different, right? The foot has many, many bones, right? Even kind of like more than the hand to some extent, or similar to the hand. It's got lots of joints, lots of muscles, and lots of nerve endings. So Belinda and I looked at some things that we thought might be interesting, and some, half of these things I didn't even know. The average person walks about 180,000 miles. So if I do some calculations, that's, close to just under 300,000 kilometers in a lifetime. So that's a lot of pressure that we're putting through our feet through a lifetime. Just like our hands, we have a unique footprint. And the big toe, if you've seen podiatrists, you've seen physios with foot pain or heel pain, we're very interested in how well your big toe is functioning, because that takes a lot of the load. And as you can see, for those of you who run a little bit or have to jump, the big toe takes a lot more weight through the actual joint. And some of you might have this extra little bone on the middle or the inside of your foot, in the middle of the foot, called an accessory navicular. And so that's just an interesting fact. It doesn't really mean anything at this stage, but that's just something good to know. Now, without further ado, I'm just going to stop sharing then, and I'll start managing the chat to some extent. I'd like to throw now to Belinda, who will now take you through the rest of the presentation. Thanks, Belle.
So I said, thanks for the intro, Errol. So I'm just going to start with going through some slides about anatomy of the foot. So as Errol already alluded to, the foot does have a lot of bones. Some of them are quite small, some of them are bigger, some of them are longer. But what this means is that there's lots of different muscles, tendons, and ligaments in the foot, and they all have to function well to get us, to walk many, many steps every single day. The picture on the right is just a simple one showing us where the plantar fascia actually is. So it's the muscle or the fascia, and we'll talk more about that in a few slides' time, that runs under the bottom of the foot. So it actually attaches to all 5 of the toes and then runs under the foot and then attaches to our big heel bone, which is called the calcaneus. The Achilles tendon, and I think this is the reason why we've kind of bulked together, because the Achilles tendon is also in a similar muscle group that attaches to the heel bone as well. And many of you may be familiar with the Achilles, that is because it's actually the biggest tendon of the body. So if you feel behind your ankle, normally you should be able to feel your Achilles tendon is quite thick. What the Achilles tendon does, it actually attaches a whole group of muscles, which is why it's also so thick and strong. So the calf muscle is made up of a group of 3 different muscles, and it all attaches to that Achilles tendon. So this is just it's quite a busy slide, but it just shows all the other different muscles. So we have these bigger muscles on what we call extrinsic muscles on the outside of the foot, but inside the foot there's also a lot of smaller muscles which control all the toes. So what actually happens in plantar fasciitis? So it's a common term that most people would refer to pain in the heel, but actually in medical terms, we actually refer to it as a fasciopathy, which pretty much means any kind of problem to any part of the fascia in the body. And the plantar fascia is just one of these parts of the fascia. So we are going to talk more about that in a few slides' time. So plantar fasciitis, is inflammation of the plantar fascia, which can lead to pain and irritation in the heel. It's normally caused by repeated stretching or maybe micro tearing of the plantar fascia, but this normally can only really be seen under very microscopic levels, maybe on MRI. So some of the main causes of plantar fasciitis, the first one will be excessive foot strain. So this just means that you're asking, or if you're suffering with the heel pain, you're probably asking too much of your foot than what it wants to achieve. Age is unfortunately going to always be a cause of some of these injuries. Obviously, as we age, our tendons, our muscles, our joints aren't quite as, young and healthy as when we were kids or teenagers. Foot mechanics is going to play a big part. So what we mean by that is if someone has what is commonly known as a flat foot, or maybe even a foot with an increased arch, this is going to change how your muscles and tendons want to work in the foot, and then can cause issues such as plantar fasciitis. Like a lot of problems with weight-bearing joints, obesity is a big cause. Similarly to foot mechanics, if someone is in improper footwear for too much of the day, it can cause these sorts of issues. If any of you have listened to some of the talks on footwear that our podiatrists have done, they will talk a lot about thongs, which obviously is a very common form of footwear in Australia. But the problem with thongs is it really causes different muscles of the foot to grip differently, and then again can cause excessive strain on these muscles and cause something like plantar fasciitis. Inflammation in the body can cause plantar fasciitis. I'm going to touch on that a bit more. And last but not least, lower limb tension. So tightness or tension in any part of the body might cause increased load or pain in the heel. Okay, so we've now talked about the term fascia quite a few times. So some of you may be wondering, what is fascia? So this is one example of one piece of fascia in the body. So fascia maps out many parts of our body, and it connects many parts of our body. So this is a picture of what one very clever anatomist did, and pretty much this piece of fascia starts on so this is a left leg, starts on the outside of the hip, and he was able to carve this all out in one piece. So it starts on the outside of the hip, goes down the outside of the knee and leg, wraps under the foot, and then goes up into the inside of the leg up towards the groin. So that's one piece of fascia. So this sort of fascia goes around the whole body. The way I often explain it to a lot of my patients is when you cut a piece of chicken, often there's that kind of white casing on the outside. That's fascia on a chicken. So I guess we're animals as well, and we also have that fascia, surrounding our body. So when we talked about on that previous slide about tension anywhere in the leg causing pain, perhaps in the Achilles or the plantar fascia, often that from a physiotherapist is referred to as trigger point pain as well. So this again might be familiar to some of you, but what trigger point pain means in quite simple terms is if you push on one part of the body, it can cause pain on other parts of the body. So if we look at this picture on the right here, this is potentially one trigger point on someone's body. So it's in the middle of the calf. But what can happen is if you're very sore or tight in this spot, if you push on this area with a cross, it can actually cause pain down into the leg, into this red area called the Achilles tendon. Okay, that potentially is because of all the fascia being connected. And throughout the whole body, there's multiple trigger points all over the body. So the shoulder, the back, your hip, that can cause pain in other areas. So sometimes when you have pain in the Achilles or the plantar fascia, the pain or the cause of the pain can also be coming from other areas, maybe higher up in the leg. And our other main condition we want to talk about is the Achilles. And the main condition we see there is often called Achilles tendinopathy. So the Achilles tendon is part of the same fascia as the plantar fasciitis. And because of that, the treatment and the management is often very similar. So I'm not going to harp into the same causes again because it's the same list as I went through with the plantar fasciitis. I'm going to stop there, and I've got a question for Errol that often might come up in some of my consults. But Errol, why do you think some people will get Achilles pain compared to plantar fascia pain, especially if I've just explained that it's kind of part of the same fascial line?
Yeah, that's I don't have evidence with my answer. It's more from, I guess, the 25 years of being a physio. But what I've tended to see in practice where people start to get heel pain, you can get some heel pain, and of course, occasionally, very occasionally, you can get people who have plantar fascia tears if they play a lot of sport or impact sport or run. But more commonly, people start to develop some heel pain, and this is on the premise that someone doesn't have an inflammatory arthritis or a particular rheumatic disease. These are people who have just started to do a little bit more work that requires them to be on their feet, maybe waiting, or a nurse or healthcare worker, or someone who's decided, you know what, I haven't been doing enough exercise, so I'll go out for a few more walks. And perhaps they haven't thought about the type of footwear that they needed to be, and they were just wearing whatever footwear, and they've decided to put more kilometers and more steps into their week. And unfortunately, where they started to see the aches and pains originated is in the bottom of their heel. And those of you who ticked plantar heel pain or heel pain as a result of the plantar fascia may have had that sort of history before seeking some sort of help. So that's where we might typically see someone with heel pain. Again, I'm with the caveat that that person doesn't have an inflammatory arthritis of some sort. When it comes to Achilles pain, in our setting, we tend to see people who probably do a little bit more impact loading. So someone who's decided to go out for a bit more of a run or a jog, or started to increase the number of kilometers they start they decided to run or playing more sport like tennis, maybe a couple of extra sessions. On this day and age, we seem to have people starting to pick up pickleball or even try to play basketball after years of being not playing. And then they might start to develop a little bit more strain into the Achilles. Saying that though, unluckily, some people can have both, but that's typically what I see. So I think people who maybe were a little bit more inactive and then started to be a little bit more active, they might get more heel pain. People who are already active, but then start to do a little bit more with more impact loading, maybe they get a little bit of Achilles. Have you seen the same, Belinda?
Yeah, again, anecdotally, that seems to be what we do see in the clinic. But yeah, definitely, as Errol just said, occasionally, unfortunately, some people might come in with areas of pain in the Achilles and plantar fascia. Okay, awesome. Okay, so what happens in inflammatory arthritis? So as most of you know, we do work in a clinic that specializes in inflammatory arthritis, and this is something that we also see very commonly in inflammatory arthritis patients. So plantar fasciitis and Achilles tendinopathy can be signs of inflammatory arthritis. So someone might come in with pain in these areas. So it's really important as a physio that I question them about other signs and symptoms of the inflammatory arthritis. Often, and this is kind of a big asterisk sign as a physio, is if the pain is on both sides. So most typically, if the pain is what we would call mechanical pain or routine plantar fasciitis or Achilles tendinopathy, it's on one side, but in the space of inflammatory arthritis, it can be in both sides. And it's most important that if a physio is thinking that the patient does see the rheumatologist for medical management, because unfortunately, if it is inflammatory in nature, the physio isn't going to help a lot. I've got one more question for you, Errol. So what would you say is the difference between routine tendon issues versus the tendon issues we see that are related to inflammatory arthritis?
Okay. With you can treat them both to some extent similarly from a physio point, but the length of time of management and how quickly you can progress might be very, very different. So that's one point. I think especially if someone, and Steph's just written in the chat to everyone, she's had aches and pains since she was in her 20s and had bilateral, I think, Achilles and plantar fasciitis on both sides. So exactly what you were referring to. And so I think if you've had pain and symptoms for a long time, both if it's mechanical or with inflammatory arthritis and it's caused inflammation into your tendons, chronically you'll get weak, right? So that's one. And irrespective, you're going to have to strengthen significantly when you get the opportunity to, because that's going to help with your aches and pains in the long term. I think the difference with, say, mechanical pain, as you've already alluded to in your slide on the causes of heel pain or the causes of Achilles pain, a lot of that at times is not inflammatory. A lot of the aches and pains that we see in people's heels and people's Achilles is a result of that muscular tension or trigger points that then create pain at the site of the heel or at the site of the Achilles tendon. On that, the question then people tend to ask is like, why do I get the pain? Why does my muscles or my fascia do that? And often it's because it's overworked. It doesn't have the strength. It's not used to the amount of load before the whole muscle, tendon, fascial system can work well. And typically then with the correct sort of exercises, mobility drills, strength drills, and so forth, people tend to get better. Whereas with inflammatory arthritis and tendon issues related to inflammatory arthritis, such as psoriatic arthritis, such as ankylosing spondylitis, and even rheumatoid arthritis, the inflammation tends to occur at where the tendon attaches to the bone. So if this is your heel and that's the tendon, my fingers are the tendon, the inflammation tends to occur where the tendon attaches to the bone. And at that point of the tendon, which is called the enthesis, is where people get inflamed and they get this sort of fasciitis. And so, as you've already mentioned, it's important to then see the doctor, get a referral to a rheumatologist. If you've already got a rheumatologist and you've got a flare, then it's important to figure out whether you're in a state of a flare with some inflammation, where you might need extra medication or change of dosage of your medication in order to reduce that inflammation. Physio management can help a little, and Belinda will go through that. But really, if you're in a flared state and you have systemic inflammation that's causing your tendons to be irritated, we really need the help of medication and hence the help of the doctors. Once that settles, physios can then help with the secondary mechanics, and again, the strengthening and exercises that I've already alluded to. Yep. Not so simple an answer, but that would be the defining point. Yeah. One, systemic inflammation causing the tendon to be inflamed. Another one, it can be inflamed if you don't have the disease, but often a lot of the aches and pains that we feel is coming from the muscles and tendons and fascia. Thanks, Bill.
Perfect. Okay, so into physio management. So hopefully once your physio has established that it's a more mechanical issue caused by muscles, tendons in the body, there's actually heaps of devices out there that you can purchase that can help, I find, significantly with someone's pain relief. They're all really easy to use. So I'm going to go through all of them. So on the left, we have something called a Strasbourg sock. What this does, and as we'll go through, one of the main complaints a lot of people with plantar fasciitis have is morning stiffness. I think the reason that is a main problem is when people sleep, normally their foot tends to their toes would drop. So I guess it's a bit more relaxed or arched. And what that means is the calf muscles, the Achilles and the plantar fascia, it's actually in a more shortened position. So when someone wakes up and they first put their foot down in the morning, all that group of muscles is then very stiff. So what this invention of the Strasbourg sock does is it actually pulls your toe up. So you're supposed to sleep with this. It can work really, really well. I think my main thing, and I always mention this to my patients, is you have to be able to sleep with a sock on, because some people find that ridiculously uncomfortable. And if that's the case, it's probably not going to work for you. But this sock is designed really cleverly in that it holds your foot, your ankle in 90 degrees, and it can also pull your toe up as well. So then the plantar fascia and big toe has a really nice stretch. But it can work really, really well with morning stiffness. Ice can work really well for patients with plantar fasciitis. Some of them really like rolling an ice bottle of water under their foot. So it does a little bit of massage and also ices the area at the same time. These green things are called heel cups. They're not expensive. Normally it's about $25 or so from your chemist. And they pretty much provide a really soft cushion under your heel. It can provide a lot of pain relief. Normally it can be slotted into like any pair of shoes. You can move it around. So it's super easy to use and again can give a lot of pain relief. On the bottom, left, we have this picture with an orthotic. As I mentioned before, one of the main causes of plantar fascia or Achilles pain can be poor foot mechanics. Sometimes in the right setting, an off-the-shelf, over-the-counter orthotic can work really well just to alleviate some of the stress onto the plantar fascia. Taping is something that we do a lot of with our plantar fascia patients as well. This is something your physio can do, but if it does provide a lot of pain relief, as a patient, you can learn to do it yourself. Another form of massage can be using something we call the spiky ball. People typically can just sit there and roll it under their foot. And last but not least, you can buy specific braces that take the stress off the Achilles and the plantar fascia area. Again, these can work really well, especially if someone wants to, I guess, do a bit more activity, do a bit more walking or running throughout the day. This can provide a bit of extra, I guess, support or alleviate some pain so that the patient can do a bit more.
So you've just finished watching part 1 of one of our recent educational events. Hope you enjoyed the content. If you'd like to access part 2, then you need to sign up for BJC Connect. It's a free platform where you can access not just the recordings of past events, but also access a whole range of upcoming future events and access our team of facilitators live. All of the details that you need to join BJC Connect are now flashing up on your screen. But otherwise, like our staff, subscribe if you'd like to see more information from BJC Health. Look forward to seeing you in an event soon.